Here is a reason why you should think twice about participating in dry January. If you're a heavy drinker, sudden cessation of alcohol could actually be life-threatening. So let's talk about it. Yesterday, I presented the case of a 26-year-old man who presented to the emergency department after a new onset seizure. He was playing video games with his friends when all of a sudden he became unresponsive and began convulsing. His friends even noted that he urinated on himself, so they called 911 and he was brought to the emergency department. He was post-ictal in the ambulance, meaning he was kind of confused, but by the time he arrived to the emergency department, he was fully coherent. In someone with a new onset seizure, meaning they've never had a seizure before, it's very important to get a thorough history. A description of the seizure by witnesses is extremely important in understanding what happened to precipitate the seizure. In his case, it did sound like a generalized tonic-clonic seizure. Upon reviewing his history that I presented yesterday, there are a few things that could potentially have been a cause of his seizure, including his history of concussions in high school, his history of recently playing video games with flashing lights, and his participation in dry January. Other things that we also like to know is there any family history of a seizure disorder, and has he had any recent infections or running fevers? Asking him about fevers or a recent infection would lead us down the path to see if this patient potentially has an infection like a meningitis that could potentially have led to a seizure. It's important to also get the medical history to see if the patient has taken any prescription or other types of drugs that could potentially be a source. A thorough neurological evaluation and a general physical evaluation is paramount. A neurological evaluation is important to see if the patient has any focal neuroscience that could potentially lead to a source like a brain tumor or any signs of elevated intracranial pressure. A physical examination is of course important to look for any potential signs of infection or other systemic signs that may be important. Lab tests are also extremely important to look for things that could potentially cause seizures like low blood sugar, or if it's a woman of childbearing age, potentially to see if she's pregnant, because eclampsia can actually cause seizures. A tox screen is important to look for substance use. Other labs that are important include checking the liver function as well as the sodium. We also look at the white blood cell count and other things to rule out infection as well. So I mentioned that he had a low sodium and an elevated AST. Low sodium is also referred to as hyponatremia and can be a source of new onset seizure. There's many reasons why people can have low sodium, but basically it's a sign that there's too much water in the blood and the brain can't fire properly. I know you've probably heard of some cases of water intoxication where someone drinks too much water, and that can potentially lead to extreme brain swelling, seizures, and even death. For this very reason. We will also perform imaging studies such as a CAT scan of the brain to screen for things like a stroke or a brain tumor. And if the CT is negative and there is still concerns, we will often also get an MRI to help further rule out those causes, because an MRI is a little bit more sensitive. An EEG may also be performed, and that stands for an electroencephalogram. That's where we hook up wires to the patient's head and look for the brain waves to see if there's any signs that may point to epilepsy. But an EEG that is normal doesn't necessarily exclude it. All of his workup points to this as likely being an alcohol withdrawal seizure. When we got a detailed history, he says he usually drinks about a 12-pack of beer per day, but when he came over to visit his buddies, he thought dry January was a good idea, and he abruptly stopped drinking about 48 hours ago. Alcohol is a depressant of our central nervous system, so if you suddenly stop drinking, all of a sudden your brain waves can become hyperexcitable and it could lead to seizure. Now let's get a little bit more scientific. Alcohol enhances the action of GABA. This is an inhibitory neurotransmitter. It actually inhibits glutamate, which is an excitatory neurotransmitter. So if you're a chronic alcoholic, your body will respond by down-regulating GABA and up-regulating glutamate. And then here's what happens when you stop drinking. All of a sudden you have way too much glutamate and not enough GABA. So you have overexcitation with not enough inhibition. Then all of a sudden your brain is hyperexcitable and you can seize. Am I making any sense here? Chronic alcohol use can also lead to elevated AST, that's a liver enzyme, and our patient had that on his laboratory studies. AST is a protein that's produced by your liver So if you are a chronic alcoholic, it actually damages your liver and it releases AST into your bloodstream. So it's a sign of ongoing liver damage. And your liver is actually responsible for storing nutrients like sodium. Alcohol also impairs your body's absorption of sodium, so all of those things combined can lead to a lower level of sodium in your blood called hyponatremia. And our patient had a sodium level of 126 compared to what the body should have, which is above 135. If your electrolytes are imbalanced, low sodium can actually lead your brain to swell, which can lead to a seizure. All right, now all this mumbo jumbo has been explained. What do we do for this guy? First of all, he needs to be admitted to the hospital and start on a 𝐂𝐬 protocol. It's a clinical assessment tool that we use as healthcare providers to help treat alcohol withdrawal syndrome. You've probably heard of medicines like Ativan to treat seizures, and this is what we use first line on the 𝐂𝐬 protocol. What does 𝐂𝐬 stand for? It stands for the Clinical Institute Withdrawal Assessment. Why do we use benzodiazepine? Benzos enhance our GABA activity, and remember I said that GABA is a neurotransmitter that inhibits brain excitation. So by giving benzos, it will actually chill our brain out. Essentially helps calm the brain and prevent further seizures. Those are medicines like Ativan, Valium, and Librium. We'll also want to correct the electrolyte disturbances like this patient's low sodium. And that has to be done very slowly, because if you give sodium too fast, it can actually cause an osmotic demyelination syndrome. Okay, doctor, my brain is actually swelling with you telling me all these words. Thiamine supplementation is also really important in these patients to prevent something called Wernicke-Korsakoff syndrome. It's a memory disorder caused by the lack of thiamine. Bottom line is that if you drink alcohol, sudden withdrawal can be life-threatening. That's usually in people that have 6 or more drinks on average per day. If you're thinking of dry January, it is really important for health benefits, but if you do drink more than 6 drinks per day, it's important to talk to your healthcare provider about how to safely go about alcohol cessation. And in our patient's case, this was literally an eye-opening experience for him, and he sought help after his inpatient admission and went to rehabilitation to assist him with quitting for good. Remember to always talk to your healthcare professional if you have any concerns, because we are here to help you. And the 988 Lifeline is also there because remember, you are never alone. We are here for you. You matter. And under the case of patient-focused and compassionate care, stay tuned next week and we'll go through another case.